the debate on the motion.
Thank you, Madam Deputy Principal Speaker, or whatever way round that actually is. I'm pleased that we are having the opportunity to discuss this important topic, and I want to thank the Health Minister for his attendance in the Chamber. I'm sure that every MLA in this House this morning can attest to the fact that every week they are meeting with constituents who are ill, in pain and on a waiting list. They have lost hope and faith in the very NHS which was meant to look after them from the cradle to the grave. Let me reinforce my belief that a well-funded, properly functioning NHS, free at the point of delivery, is my sincere goal. It saddens me that we are very far from that objective. I would also say, Madam Speaker, that tackling this issue is one of those pivotal issues in which the success or failure of this executive will be judged. We cannot fudge the issue or talk about everything else, but not address this most fundamental of issues that impacts our constituents every day. I would like to make some progress. Minister, I understand and appreciate that you have a challenging brief, and hope that in highlighting this issue in the Chamber today, that we will lend weight to your arguments for resources to tackle the problem. Equally, Minister, this is an issue that will not go away, and we will hold you and your executive colleagues to account on the progress in tackling this one. In bringing this debate, I want to be clear about the uncomfortable truths about waiting lists. The Northern Ireland Audit Office report of 2023 makes stark reading. No formal waiting time targets have been achieved since 2014. Between March 2017 and 23, patient waiting lists exceeding maximum waiting time targets have increased exponentially. The equivalent of 26.3% of the Northern Ireland population is on a waiting list, compared to 12.4% in England. This means that more than twice the proportion of our population are currently on health and social care waiting lists compared to England. In Northern Ireland, 51% of those on a waiting list were waiting over 52 weeks for assessment or treatment, compared to 5.4% in England. From the Department's own waiting time statistics, we know that 87.9% of patients diagnosed with cancer received their treatment within 31 days, versus the 98% target, with gynaecology having the poorest outcome of 78.1%. Within the statistics, there are huge regional variations, with some trusts performing much better than others. This postcode lottery of treatment is unsustainable and unfair. Within the Southern Trust area, the wait for a routine urology assessment is 153 weeks, and a potential further wait of 151 weeks for treatment. The wait for a rheumatology outpatient assessment is 201 weeks, and for neurology 172. I have used figures for my local trust. Other figures are available, and the wait times are just as shocking. This is long past the point where we can call this a service. It is clear that very poor waiting time performance is significantly increasing the number of patients who are at risk of developing serious conditions and illnesses, and their quality of life will have been reduced by spending protracted time on tests, waiting on tests, treatment or surgery. There is also deep concern about the prevalence of late diagnosis. Between 2012 and 2017, a quarter of all cancer diagnoses were made in emergency departments and not in primary or elective care. It is morally unacceptable that we are allowing patients to reach this stage in their journey before serious illness is detected. Minister, we all know that this is not a sustainable position. We know that Northern Ireland has the worst waiting lists in the United Kingdom. Simply doing a little more or investing a little extra won't make a significant difference, and that is why it is imperative that you and executive colleagues have a clear plan to reduce waiting times. In its latest funding offer, the UK Government has said that it will grant an additional £34 million to tackle waiting lists. However, the Northern Ireland Audit Office report indicates that £909 million would be required to substantially reduce waiting times. In practice, and the elective care framework estimated 707 million was required to ensure that by 2026 waiting times do not exceed 1 year. The Department has now conceded that these targets cannot be met. And I know that you're very soon in post, Minister, but is this still your view? Stabilising this fundamental public service will require significant investment in funds. And we need, Minister, your department to provide robust figures on the cost of stabilising the service. And we will be watching the future budget proposals for investment. However, funding is not the only solution. Recruitment and investment in staff is vital. And I hope, Minister, that you will be able to reverse the decision taken last year to halt the recruitment of nurses onto our university courses. We trust that you will be able to reach satisfactory agreements in relation to pay, that our staff can feel valued, and that you will work with trusts to ensure that staffing levels are safe and appropriate. While there is a need to increase the number of staff, this must also be accompanied by an overhaul of an adequate, out-of-date and poorly maintained physical and digital infrastructure. These investments will lead to more efficient delivery of services. Other options which must be delivered include the use of primary care for routine elective procedures and tackling the extreme pressures on social care. We need to be realistic about the extent of progress our system in its current form can achieve. We clearly don't have sufficient capacity, and all the retraining and recruitment efforts in the world won't turn that around in the short term. We need to find partners who can assist us, and we need to also look beyond our usual local providers. Our small independent sector in Northern Ireland will undoubtedly have a role to play, but it is dwarfed by the volume of the additional capacity that is needed. I will shortly, if you just let me finish this point. Continuing in the old way with small contracts at the end of the financial year will have only minimal impact. Indeed, I was very concerned when contacted by one of the private sector providers, indicating that patients that they had been anticipating this month for urgent red flag endoscopies have not been forthcoming due to trust financial concerns. They had made arrangements to carry out 2,000 endoscopies and 1,000 urology procedures in the 6 weeks up to the end of the financial year. Have these red flag patients simply ended up on another waiting list? I can only imagine the fear and concern. I'll give way to the member.
I thank the member for giving way, and indeed I share the concerns she raises in relation to waiting lists and believe that it firmly impacts on each and every one of our lives. But does the member appreciate and agree with me that the absence of these institutions for 2 years and 3 years prior to that have contributed to the devastation inflicted on people and the huge and growing waiting lists that we face in Northern Ireland?
Can I thank the member for his intervention? I'm not interested in playing politics on this one today. It is extremely important for Northern Ireland that we now go forward with a plan to sort out this issue. And every day those people are in pain actually want us to do that. Northern Ireland can only do so much ourselves. We must seek to partner on a much larger scale with national or global providers that can work alongside us and provide the additional skilled staff required in the short term as we enhance our own capacity. Let me be clear, investing in our own staff and infrastructure is my preferred option, but the needs of our waiting lists and the urgent requirement to address capacity will take radical short-term solutions. And I know that some in this chamber may have an aversion to considering working alongside the independent sector, but I'm not necessarily even suggesting that we have to pursue private providers. There are a number of non-profit organisations from the United States, for example, which operate internationally. The Pittsburgh Medical Centre is a global non-profit health enterprise with 92,000 employees internationally, 40 hospitals and 70 cancer centres. It has partnered with a number of hospitals in the Republic of Ireland since 2006, providing state-of-the-art radiotherapy treatment in Cork and Waterford, and also involved in hospitals in Kildare and Kilkenny. There is an undoubted political and broader interest from the US in Northern Ireland's affairs, and perhaps there are ways we can encourage and harness that for genuine practical benefit and for the welfare of our patients. We should not underestimate the anxiety people experience waiting for a diagnosis or the impact on loved ones. We recognise that additional money alone is far from the answer, as Northern Ireland has already the highest per capita spend of the whole of the UK. But we must maximise the outcomes from investment. We must see more procedures per session, and it is surprising that this can happen in the private sector but not in our NHS. There must be a clearer separation between emergency and planned care.
Can the member bring her remark to a close?
Yes, I had assumed I was getting an extra minute because
Not when you're moving.
All right. Sorry, thank you. And we need to sweat our assets. Can I take 2 seconds, Madam Speaker?
The member's time's up. Sorry.
Okay. Thank you.
I'll call on Colin McGrath and move the amendment. Thank you. Colin, you'll have 10 minutes to propose and you'll have 5 minutes to wind. Please open the debate on the amendment.
Thank you, Madam Principal Deputy Speaker. There has been no greater issue on highlights how sick our health service is than that of the waiting list debacle. So the fact that we are raising that and discussing this so early in our return is welcome. People have been languishing for too long on waiting lists. And it's probably too simple to simply point to COVID and say that that was the cause of any of the lengthy lists. It certainly didn't help. But the genesis of the problem goes back much, much further than that. To find the real answer, we need to delve into the strategy storage room in Castle Buildings, for it is here that we'll find the real cause of the problem. It's in that room that we will find many undelivered strategies, many that would have helped the waiting lists if they had been implemented. It's in that room that we would find many announcements to reorganise our health service. It's in that room that we would find plans that would reorganise and help if they had been enacted. But it's been the inactivity of Health Minister after Health Minister and Executive after Executive that has meant that we are where we are today with some of the longest waiting lists in Europe. I'll not, because you'll have your chance and I don't get any extra time. And just how bad is that problem? In September past, we had 116,000 waiting on an inpatient or a day case, 429,000 waiting on a first consultant appointment. That's 545,000 people here waiting to see a doctor with a population of 1.8 million. That's nearly 1 in 3 waiting. And the Sinn Féin DUP duopoly of power sharing, the stop-start government, which began whenever you took over back in 2007. Since then, waiting lists are 5 times longer. 5 times longer. That's not a success in government. That is an abject failure. That's an embarrassment. In Scotland, the figure is 627,000. Scotland has a population 3 times what we have here. In Wales, the figure is 734,000, and they have 1.5 million more people. And before we hear any of it, the Tories fund them as much as they fund here as well. So let's not trot out the old lines so quickly and have a look at our own actions as well. It is political inability to solve the problem above anything else that is causing and feeding the waiting lists. It is stop-go politics that is the major harm of our health service. It is a health service that is crippled, being unable to take decisions because there is no minister that is causing the real problem. Now, the solving of the waiting list crisis will require a 2-pronged approach. One side will deal with those that are on the waiting list at the moment and need to be seen and sorted. The other is to make sure that we never end up with the lists as long as they are and have been. And I'll come back to that shortly. But on the issue of the political inactivity, having no assembly, having no executive, no minister for health, I'm somewhat surprised that it is the party opposite that is raising the issues of waiting lists, given that they have collapsed the government in this place, for the past 2 years. And of course, an executive partner that collapsed it for 3 years prior to that. I am in no doubt that that hiatus, that double hiatus, has seen many people die while they were on waiting lists. They will have died with their health issues unaddressed, left in pain, left suffering, left as a burden on their family because their health issues could not be addressed in a timely manner. I think that of all the parties that could have brought emotion on the state of our health service, that it is the party opposite that collapsed government here for the past 2 years, paralysing our officials from managing the health service properly and causing the environment that has driven those waiting lists up, is a bit of an embarrassment. If you cannot draw the line between inactivity and having no executive and no government and the driving up of our waiting lists, that shows a major disconnect from reality. But we are where we are. We have waiting lists, and I have mentioned before, I think there's a two-pronged approach that is required. We must see the cash injection that will allow the backlog to be cleared. Those figures need to be driven down, down, down. And that will only happen by either asking our already overstretched staff to do more, which I don't think is possible because many of them are driven to the edge, or else we will have to use our private sector. It does exist out there and we will have to use it. But let's not fool ourselves. These places are often staffed by medics that work in the NHS as well. How many of us have had constituents that come in and say, I went to my doctor and he said that I can't be seen by a consultant for another 6 or 8 months, but he's told me if I can go private I can be seen next week. And often it's the same people. So we need to clear the backlog and we will have to use that private sector. And this is where our amendment comes in to try and help with that, by explicitly calling on the Health Minister to refund the cross-border initiative and allow patients to utilise hospital and health services that are often closer to their own home than the places that they have to travel to. The scheme was successful. It was used by hundreds, if not thousands, of people previously, and I think that there's an opportunity for that to help and assist. If we're doing something right, which we've done in the past, let's do it again. The second approach is that we need to sort out the mess and see true and meaningful transformation. It is only that transformation of our health service that will allow the waiting lists to never grow to the length that they grew to. We must transform so patient flow improves. Just a few months ago, there were 4,000 people waiting on a domiciliary care package. And how many of them lay in hospital when they didn't have to, but they couldn't get home because there wasn't the care package? And that backlog goes out of the ward, goes down into the emergency department, it goes out into the ambulances that are parked outside, and it ends up when people dial 999, they can't get an ambulance to come and help them. The backlog is a chain effect, and we have to break that chain. That needs investment. It means recognising and valuing our domiciliary care workers so that it becomes a career that attracts people. And our cancer waiting times are horrific too, with many of the established targets not being met. Just one example, breast cancer patients. The target, 100% of referrals to be seen within 14 days. We haven't reached that target in 12 years. 12 years from we reached that target. And another example that people won't probably think about as top of the list, but dental waiting times. Before we talk about dental waiting times, let's talk about getting access to a dentist. Many in our community struggle to get a dentist to register with. They struggle to get an appointment. And if you're NHS, forget about it. But what is it that is the problem? We don't fund our dental sector properly. It literally costs dentists to be able to deliver NHS work. Who is it that would go to work if it's going to cost them to do their job? That isn't a real-world model. It isn't working. And when it isn't working, it's people that suffer. So we need to see a transformation plan with a budget, with an action plan, with a time scale for implementation on that transformation. We need to see what the changes are, but crucially, we need to hear what the benefits will be. The public need engaged with and informed so that they can see that the loss of a service from one medical centre, the gaining of another service from somewhere else, and the inclusion of a different one or a changed one, that will mean better services, better delivery, shorter waiting times, improved outcomes, and happier, healthier people. Then the waiting lists will come down. And then this House, if this House is to be an effective, proper, legitimate scrutiny chamber, will never let the waiting lists get to the heights that they have gotten to. Thank you.
I call the chairperson of the Health Committee, Liz Kimmins.
I welcome this opportunity to make some remarks as Chair of the Committee for Health before speaking as my party's health spokesperson. Tackling waiting lists will be a key priority for the Health Minister in the coming years. The Audit Office report on tackling waiting lists, published in October 2023, outlines some of the key challenges for the Department and the Minister. It outlines waiting time targets have not been achieved since 2013-14, and that the Department has already stated that the current framework will not achieve its waiting time targets by 2026. So we can't keep doing what we're doing and expect lists to get shorter. As of the end of September 2023, we had 428,858 patients waiting on a first consultant-led outpatient appointment. That's up from 127,095 in March 2014. In 9 years, that's almost 1 in 4 of our population waiting on a first consultant-led appointment. We have 115,929 patients waiting for inpatient or day case treatment, up from 49,341 in 2014. That's 1 person in every 16 of our population waiting for treatment. And we have 188,850 patients waiting for diagnostic tests, over double from what it was in 2014 at 69,042, and that's 1 in 10 of our population waiting for tests. Due to the size of these lists, it can be easy to get lost in the statistics, but the reality is that each of these numbers are individuals in our families and our communities. Each of these cases are on these lists for a reason, and they need to be seen by the experts as quickly as possible. Unfortunately, due to the size of the list, people are waiting for record times. The number of people having to wait over 52 weeks for an initial appointment or for treatment is at an all-time high as 69.8% of people waiting over 52 weeks for ear, nose and throat treatment. As individuals wait on these lists, conditions are getting worse. People are experiencing pain, people are understandably concerned about their condition, and this does have an effect on well-being and mental health. And it can be a bit of a postcode lottery in relation to waiting times. For example, if you live in the Belfast Trust area, 33.8% of people will wait longer than 26 weeks for diagnostic tests, whereas it's only 13% in the Northern Trust area. We do need transformation of the health system and long-term investment in the health service to allow the very capable and committed surgeons, doctors and nurses to deliver the service they want to deliver. We need to ensure we have the right infrastructure and resources to treat our most vulnerable people. We can't allow people to go on waiting lists and progressively get worse while they wait for the treatment they need. But that will mean needing to take tough decisions on services. That will mean learning from best practice across our trusts and further afield. That will mean the need for a fully resourced multi-year budget. That will mean training and recruiting more surgeons, doctors and nurses. In the coming weeks, the Committee will hear from the Minister, the Department, the Trusts and other key workforce stakeholders on waiting lists. The Committee will undertake its scrutiny role and look forward to considering any action plan that is brought forward by the Minister to address this issue. I'll now make some remarks. Can call it as Sinn Féin Health spokesperson on this. And as we've discussed, waiting lists have continued to soar, particularly in the last number of years, and we're seeing some shocking figures over a short period of time. As people face unprecedented waits for the surgeries and treatments they badly need, inevitably causing their overall physical and mental health to decline further and creating additional pressures on our already struggling health service. In NDNA, commitments were made to prioritise tackling wait lists, yet 5 years later, not least due to cuts to the fund by over 30 million in an effort to manage budgetary pressures, but also as a direct impact of the COVID pandemic. I will, yeah.
I thank the member for giving way, and I couldn't help but think when she was talking there about Daisy Hill, which is obviously close to both our hearts, being near Armagh and Southdown, and she'll agree with me, Daisy Hill is strategically placed on the Belfast-Dublin corridor, and I think roughly 3 million people can access it within 90 minutes. Would she agree with me that it is positive that Daisy Hill is now an elective overnight surgical hub, but that it can do so much more in terms of playing its role in tackling waiting lists, and what we need to see is the Minister publishing a plan for actual investment in Daisy Hill so that it can actually help to address some of the issues that we're speaking about today in terms of waiting lists.
Members, an extra minute.
I thank the member for her intervention. I think that's a critical point. As she has alluded to, Daisy Hill is a hospital very close to both our hearts, but a very, very important hospital in our hospital network, and can offer so much to tackle the issues that we're dealing with here today, with the fantastic staff and services, and most importantly its key location in relation to on an all-island respect as well. So I think that's a very, very important point. But fundamentally, if we are to tackle the huge problem of waiting lists, then we need to address the workforce crisis that is impacting right across our health and social care system. If we do not have the staff required to deliver the services needed, that means the domestic staff in our hospitals, theatre nurses and doctors, specialist surgeons and consultants, auxiliary staff, domiciliary care staff and rehab staff, all of those staff who cover a wide variety of roles which a patient will come into contact with on their journey before, during and after they receive the surgery or treatment they've been waiting on, then this problem will only get so much worse. It is positive that the Executive has prioritised public sector pay, and I do hope this will go some way to ensuring we can retain the fantastic staff we currently have, and in the longer term attract staff to fill the thousands of vacancies that continue to exist in every corner of our health
Comments
service.
to a close, please. Time's up.
Do I not have an extra minute? Oh, sorry. Right, thank you.
Okay, I call upon Deputy Chairperson of the Health Committee, Donny Dunley.
Madam Deputy Chair, and could I thank Mrs Dodds and Mr Robinson for bringing this motion to the Assembly today. I look forward to working with both of them as fellow members of the Health Committee. On behalf of my party, we will be supporting this motion. Mr Speaker, Madam Deputy Speaker, the current waiting times in Northern Ireland are deplorable and unacceptable. As it is stated in the motion, none of the formal waiting targets for health and social care services in Northern Ireland have been met since 2014. Some of the more specific statistics are truly shocking. The Northern Ireland Audit Office report has highlighted there just how rapidly the number of people on waiting lists has risen. For example, since March 2014 to March 2023, the number of people waiting for an initial outpatient appointment has risen by 216%. The number of people waiting for hospital admission has risen by 147%, and the number of people waiting for diagnostic tests has risen by 151%. The same report also highlights how these numbers will only get worse without imminent action. For example, the Department of Health's elective care framework has projected that the outpatient waiting numbers could grow by 91% from 335,000 in 2021 to 640,000 by 2026. And the inpatient waiting list could grow by 206% from around 100,000 in 2021 to 306,000 in 2026. These numbers are surely not sustainable in a population of approximately 2 million. Madam Deputy Speaker, these are huge numbers, but it shouldn't be lost on any of us that these are our families, our friends and our neighbours and people in our communities. These are people living in pain, losing their mobility and suffering from mental health issues and loss of well-being while they're waiting on tests to see whether or not they may have a very serious illness. Previous attempts to reduce waiting times have not been successful. Previous departmental initiatives, such as the elective care plan in 2017, with a target of ensuring that all patients would be seen within 1 year, did not meet its prescribed targets. On the basis of the aforementioned 2026 projections, the Department will not meet its targets as set out in the current elective care framework from 2021. We need to ask why waiting lists are so long in Northern Ireland, especially when compared to the rest of the UK and Ireland. Many of the issues facing Northern Ireland and our health system have been national or international in nature, such as the impact of austerity, Brexit and especially the COVID pandemic. But when we don't see such devastating numbers in England, we can't ignore or forget the damage done by political instability in this place, particularly the fact that we have not had an executive, a health minister or a health committee for 5 out of the last 7 years. And 2 of the years when these positions were filled, they were understandably had to prioritise managing the pandemic, making meaningful reform impossible. It is welcome that we are back in this chamber and debating this and other vital issues, but until we have a truly sustainable political system, we will not be able to deliver the transformation that is urgently needed. With that in mind, we must reform these institutions to ensure that never again one party can hold down the entire political process. It won't be lost on anyone that the waiting lists have got much worse during the period when the Assembly is not functioning. But there are a number of key issues specific to the health system I would encourage Minister Swan and the Department of Health to consider. One of the reasons why our waiting list is so long is because too many people are referred on to them in the first place, rather than being diagnosed or treated quickly along a more appropriate pathway. As highlighted in Bengoa report, the majority of HSE resources are invested in delivering acute care, and as a result, some services have been delivered suboptimally. The evidence is clear. Specialised procedures concentrated on a smaller number of sites and dealing with a higher volume of patients will improve outcomes. We support such reforms, focusing on providing diagnostics and treatments far more quickly, especially within primary care, and this will assist in bringing down waiting lists. Another issue remains the difficulties around recruiting workforce and vacancy levels in particular. On the 30th of September 2023, there were 6,920 HSE vacancies across Northern Ireland, a vacancy rate of 8.2%. This represents a 14% increase when compared to September 2018. A major issue remains the lack of legislation on safe staffing and adequate pay, 2 very important issues that I would encourage the Minister to bring forward legislation on before the end of this mandate. But we have other issues specific to Northern Ireland. For example, the higher wages available in the Republic of Ireland has led many consultants to work there while continuing to live in Northern Ireland. This has exacerbated consultant vacancies. On top of those other factors is the intensity of COVID-19 pandemic, which our health service has not fully recovered from. I know these issues are well known to the Health Minister, and I look forward to his plan for beginning to address and progress and transformation. Thank you.
Thank you, Donny Cullen on Chambers.
Principal Deputy Speaker, and I welcome the chance to participate in this important debate. It's been 2.5 weeks from the restoration of the Assembly and the Executive, and today's debate, I hope, will act as an important and early opportunity for all parties around this chamber to put on record their commitment to making tackling waiting lists one of their greatest priorities. Northern Ireland waiting times position is utterly abhorrent. It's outrageous as much as it is morally intolerable that we have so many people on waiting lists. We must also never forget that with the passage of time, it is recognised that some patients come to even greater harm while they endure the stress and pain of delay. I'm sure every MLA in this Assembly will know a friend or family member on a list for either a consultation, a test or a procedure, and similarly, we will all have been shocked by stories, experiences and sometimes delays encountered by our constituents. But as the motion rightly puts it, our waiting times have been falling behind for the last decade. There are lots of reasons for that, but I'll only mention 2. Firstly, decisions were consciously taken at that time by previous ministers and senior officials to no longer bridge the gap between limited capacity and increasing demand with additional funding allocations.
Would the member give way?
I will.
Would the member agree with me that the issue has been that there hasn't been the support given to the Health Minister during the previous period of time, and what we need to see now is a dedicated commitment from all executive parties and everybody around this table to be able to support our Health Minister in this difficult task?
I absolutely concur with those remarks. Whilst I understand that the Executive was facing financial constraints of its own, such unilateral cessation of funding put many waiting lists into a tailspin. And as I said during the budget debate yesterday, what would benefit the health service most is longer-term funding certainty. But in the absence of that, specific waiting list initiatives would have been critical in slowing the tide. And secondly, an equally damaging slate of decisions or steps were taken in relation to workforce. Critical training positions were either reduced in number or didn't keep up with the rate of expansion which was necessary. That unfortunately left a workforce too small and too fractured to be in a position to reverse what very quickly became a rapidly deteriorating waiting list position. Whilst I note the motion is asking for an action plan within the next 6 weeks, with respect to the proposers, we don't need any more words down on paper. We need focused and targeted delivery of what has already been said is deliverable and to which all political parties previously give their support towards. The proposer mentioned the capacity available within the private sector. I suspect that the Minister would love to take up the offer over the next 6 weeks if he had the money. And whilst every so often there is a glimmer of hope, such as the restoration of pay parity in January 2020 or a big expansion in training numbers, sadly the failure of politics often gets in the way of permanent improvements and regression creeps back in. I'm really fearful that in the time ahead that we will look back to the most recent 2-year period of political stalemate and the 3 years that happened from 2017 to 2020 and see just how much enormous physical and mental harm was inflicted upon so many of our people. Whilst there have been some hugely welcome progress made with the strategies and action plans published in 2021 and 22, like so many other important areas of work, they suffered as a result of funding uncertainty. And of course, it's not just those people stuck on a waiting list that have to endure the fear and the concern of delay. We should never forget the moral distress being felt by clinicians. They can see the needs of their patients, yet all too often they know that the patient isn't getting the support they need, that their skills and judgment tells them is really necessary. That is why it would be unforgivable if we didn't best maximise every single opportunity available to us, both within and outside of the health service here. The proposer, in her opening remarks, referred to uncomfortable truths. There should be no doubt that our absence from this chamber for 5 out of 7 years has not been helpful to any of our public services. We owe it to the people of Northern Ireland to work together to pull our health and social care system back from the brink. We will only achieve this by working together and not making health a political football. However, I have a sense that we may drift into that situation. The public of Northern Ireland will not thank us for doing so. Thank you.
Thank you. Our next speaker is Orlia Flynn.
And I speak in support of the motion and the amendment today. And obviously, just to say at the outset that we all know that the current situation in relation to our waiting lists at present is completely untenable for both patients and for our staff. I know that some other members have mentioned cancer, domiciliary care, gynae and oral health. But I would also like to say that we know that mental health and physical health are obviously very intimately linked. And I do want to touch on the fact that the long waiting lists also for mental health services in particular are also unacceptable at the moment. Poor mental health alone, aside from the elective care and the physical mental health, is costing the economy here $3.4 billion each year. And 1 in 10 of our children and our young people at any time are experiencing anxiety or depression. We heard recently, it was carried in the media, it was last week or the week before, the figures that 10,000 children have sought mental health support last year, and a third of those were still waiting on their first appointment just by the end of 2023 there. So I know that the motion also does refer to the fact that people need to receive that same time access regardless of their postcode or where they live, and we all know that at present that's clearly not the case. And just to go back to the children's mental health story that was covered the other week, again it just shows you how waiting times are varying between the trusts. So the average waiting times was going from 5 months wait in the Belfast Trust to less than 9 weeks wait in the Southern Trust area. So it's definitely an issue that we need to grapple with because it's not fair. And some children are literally waiting years on getting mental health supports. The longest wait was within the Belfast Trust, that some children were actually waiting nearly 2 years. And I think, like, obviously in terms of protecting our young people and looking out for our children, I think that these waits are just wrong, and no family, no child should be waiting that long on a waiting list. Again, the CAMHS funding at the moment is approximately 20 to 25 million per year, which is around, it's between 6.5% and 8.5% of the overall mental health budget. And I know that the mental health strategy, the hope is to try and increase that percentage of the budget up to 10%. So I'm hoping that will be the case in the time ahead, because again that will help with the overall waiting lists. The recent workforce review that was done in terms of mental health has shown that we need almost 2,000 additional workers to provide adequate mental health services. So again, when we're talking about, in addition to funding for waiting lists, which absolutely is an immediate priority, we also need the additional funding for additional training places and for our workforce. And again, in terms of mental health, that would be specifically around psychology and psychiatry services. Yes.
I thank the member for letting me intervene. I know mental health is a real passion of hers, and would she agree that also we need to ensure that the community and voluntary sector are included in terms of mental health provision as well in our communities?
The member has an extra minute.
Yes, thanks very much for the intervention, and I completely agree. And my next point was actually coming on to the early intervention and how we can get in there, you know, in some avenues, get in there quicker with children to try and prevent them ending up going on to different waiting lists for different issues when they grow into adults. So the community and voluntary sector are critical to all of that as well. So thank you very much for that. And again, it's important that people are getting provided with the right support at the right time. So regardless if you're starting off with a mental illness or a mental health problem, that will have an impact on your physical health the longer you have to wait to be seen. And then vice versa, if you're on a waiting list with a physical health problem and you've long delays to be seen, then that can also impact on your mental health. So we need a two-pronged approach to try and help and support people with both physical and mental health issues. And then again, just some stats on the waiting list for adult mental health services. We know that they've almost doubled over the past 4 years. The number of young people waiting for access to CAMHS has tripled over the past 4 years. So again, someone had mentioned earlier, we need to be making sure that it's not coming down to people's personal finances in terms of how soon they can be seen or how soon they can be treated, because we know that not everyone can afford it. And the people who can least afford them and pay for them are sadly the people that are living in our most deprived areas here locally. And again, just, yes.
I would agree with the member, and I think it should be noted that Northern Ireland households have the lowest disposable income in the UK as a whole, and certainly we have lower capacity to access private medical health care. So although I'm personally aware of people who have used large chunks of their savings and even borrowed money to access medical care, would you agree with me that this has created a two-tier health system?
It absolutely has, and it's completely unfair, I think, to expect any family, especially families who don't have the means and don't have the finances, to try and have that additional pressure of trying to pay to get their loved ones to be seen and treated in terms of their health care. I think I'm out of time, am I, Chair? No. Okay, so yeah, look, maybe just to finish off then, I know that the motion was saying it does recognise the impact of the mental health and physical health in terms of our patients, but we know that everyone that's out there and that's watching this debate at the moment and who are waiting on these waiting lists, it's having a massive, massive impact on their lives. And I think that, especially in terms of the amendment as well, any practical steps that we can take and the Minister can take and the Executive can take to try and help with these waiting lists, I think we need to make that a priority for everyone. So grateful for the motion today and in support of it.
Since this is Alan Robinson's first opportunity to speak as a private member, I would just like to remind the House that the convention is as all making their first speech is made without interruption. Alan Robinson.
Thank you, Principal Deputy Speaker, and my congratulations to you in your recent elevation to this House. Before I begin my remarks on this very important topic, can I just step back 2 years to offer my appreciation to those across East Lothian Derry who ensured that there would be 2 members of my party to represent their interests. I would also like to pay tribute to George Robinson, MBE, whose seat I replaced. George served 18 years in this place and began his almost 2 decades stint in here at a very youthful age of 62. Unfortunately, having enjoyed only 11 months of retired life, he was struck down by ill health, but typical of the man that George is. He's fought his way back, he's living independently again, he's back to driving, and he's back to enjoying and following local Irish League football. And I'm sure this House, especially those to my right, will extend its good wishes to him as he returns back to good health. Given that this is my maiden speech I suppose it allows me to speak a little from a very personal perspective today. And it allows me to express my frustrations as someone with long-standing health conditions and with having been on multiple waiting lists and having just recently been put on yet another. Today we will all be able to share stories of constituents who have visited our offices seeking assistance in the hope of climbing a lengthy waiting list. All of us can give accounts of people who we represent having no other option but to part with their life savings or to borrow many thousands of pounds for urgent treatment, forcing themselves into a world of debt. Good, decent, salt-of-the-earth people who may have worked themselves to the bone all their days, who paid into the NHS only to be let down. And I mean this with the greatest of respect, but while they part with money they can ill afford, others cannot. They descend into greater ill health, which ultimately becomes more complex and expensive to treat, and some even die. That's the stark reality that we're dealing with. And whilst we could all fill the business of today with examples of human suffering, we must also deal in the hard facts. We've heard earlier, as of September last year, 429,000 people were waiting on a first outpatient appointment, of which half were waiting a year. Some of those people will die, and at best their quality of life will be poor. And those waiting times are the worst in the UK and amongst the poorest outcomes in Western Europe. And we heard earlier that a quarter of all cancer diagnoses between 2012 and 2017 were made in EDs. And that's a postcode lottery that has been played out in relation to cancer wait times, with the Western Trust seeing much better performance towards meeting targets than other areas. I could go on and on and on here today, but I just simply don't have the time. The new Health Committee meeting heard last week the stark reality that we all must bear. 34 million from the British Government to tackle waiting lists is nowhere near enough, and indeed it would take hundreds of millions and even years to properly address. And that's not my words, but it's the words of the CEO. And that brings me to my own personal experience. One such waiting list that I was placed on several years back, where my GP had initially told me that I would have an 18-month wait. 18 months came and went, 19 months, 20 months, 21 months. And when I became aware that the consultant carried out work in the private sector, I queried, merely out of interest, how soon I could be seen. Could I attend next Thursday? Was the answer from the consultant's PA. Could I attend next Thursday? So the take-home message for me was that the wealthy can stay healthy, whilst the rest of us just have to wait. But the right to health should belong to everyone. But it also showed me that the capacity within the private sector is one that should be grasped. The use of private hospitals and providers across the British Isles and further afield is critical and looks like the only short-term option. This should not just be focused on surgery, but the full suite of professional skills and services needed to reduce the current backlog. I accept that there have been gains in recent times with the ongoing development of dedicated elective sites, including regional day case and overnight stay centres. However, significant further expansion is required if we are to see better progress in dealing with waiting list backlogs. We must maximise outcomes from additional investment. Continue with the same level of small contracts with independent providers cannot deliver the tangible progress that we crave. The Department of Health must be seizing opportunities to forge larger national and global partnerships with NHS in other parts of the UK and independent providers to crack down on waiting lists. We owe it to the thousands upon thousands of our constituents.
Time's up. Thank you. Colin Newell McAllister.
Thank you, Principal Deputy Speaker. I rise to support the motion today. I'm grateful for the member who brought it forward. Indeed, in our first committee meeting that we had last week, it was an issue that all of the members shared, and we look forward to having the Minister at Health Committee to discuss plans to tackle the waiting lists soon enough. And as I said yesterday or last week when we spoke about health and the Women's Health Strategy, we recognise, Minister, that you're only in the post a number of weeks. But you were Minister for a number of years before suspension, so I don't doubt that you can really hit the ground running and that you will come back to us, maybe not 6 weeks, but hopefully soon enough, to actually set out what actions that will take to drive those waiting lists down. We've heard from many people in the chamber today regarding the waiting lists. Despite us spending more per head in Northern Ireland than anywhere else in the UK, we have by far the longest waiting lists, and often those who have the means to pay go private, further exacerbating the problem because, as the previous speaker just said, and I assumed what you meant was it was the same consultant that you were waiting to see through the NHS, but you could pay private and see them quickly. Where is the equity in that for the people of Northern Ireland? We really need, as many speakers have said, an NHS which is free at the point of entry from the cradle to the grave. But one of the reasons that I want to focus on why the waiting lists are so long is because there are no spaces in our hospitals too, because their bed capacity is just maxed, and it's because people cannot be discharged on time. We have seen in recent years, especially around the Christmas period, when times are really tough, of families being asked to come and pick up loved ones, maybe look after your loved ones more at home. But really, we shouldn't have to do that in this day and age, rely on loved ones to actually take that care of people who deserve it, whether it's in hospital or in their own home. But why are we at that situation? Because domiciliary care is not sufficiently funded, but also it isn't sufficiently tackled in terms of how we appreciate that service. When we pay people the lowest of wages, what do we expect? They're not going to stay. They're going to go elsewhere, and so further exacerbating the problem again. We need to invest in the workforce when it comes to domiciliary care, so those who can enter either through short stays at rehabilitation or at home could actually be sufficiently targeted with doing that. I also raised at the Health Committee last week the options around domiciliary care and where we go with the future, and in particular the 15-minute wait. We all know elderly loved ones who do not want to have people come into their home to take care of them, but they need that, and so they accept it. But when they have people coming in, dropping and going, just doing a check, 15 minutes and out, that's not the service that really we expect. And I did raise that issue of the 15-minute visits, that can we get to a point where we move on from that? But investing in that service, investing in the workforce, upskilling people will really help to create that bed capacity and get people off the waiting lists. Yep, of course.
I think she raises a very important point, and it comes back to the issue of workforce. And I think therein lies the problem. To start to address the workforce crisis, we first need a plan to do this, and we need to see that plan. And I understand there are reviews going on, but we need to see a plan published, and we need the proper funding to support this. And that's why we need to continue making that case to the British Government to be properly funded here, so we can deliver on all these things.
No, I would agree.
Has an extra minute.
Thank you. I would agree, and I don't doubt that the Minister also agrees that the British Government should fund us to our level of need, and we will continue, with, like all executive parties, to make that case. And I was actually going to bring on to the issue of the Audit Office report in 2023 on tackling waiting lists. A number of people have mentioned it here today, and I hope that perhaps the Minister can give us an update on where we are with 9 of the recommendations within that report. We have a number of organisations here in Northern Ireland who do a lot of work for people within the sector, whether it's CARS NI, the Royal College of GPs, the Royal College of Surgeons, who all have their own thoughts on how we can actually move forward. But we need to listen to them. They are the experts. They work with people every single day. And in fact, one of them, the Royal College of Surgeons, did say that over the next 4 years, 91% we could potentially looking at, 91% of surgeons retiring. Where is the succession planning? Where is the workforce training to ensure that there is not a huge gap there and further exacerbating the waiting lists even more? I want to talk about where we should go. We should go to a situation, and Alliance would like to see the policies that are kind of implemented in some of the Nordic countries. We have the 7 and 1990 process for non-emergency care. You see your GP within 7 days, a specialist consultant in diagnosis within 90, and treatment for that within a further 90 days for non-emergency care. That's the long-term vision, and I recognise there's a lot of work to actually get there in the process. But I recognise that this will not be done just by parties speaking up in the chamber. It needs to be done by leadership from the outside too. And I would call on all parties, not just within the executive, but actually the opposition parties too, to get behind the issue of reform in healthcare. I mean, I understand what the members from the opposition said, but whenever members such as Justin McNulty stand up at meetings regarding Daisy Hill Hospital, mocking Bengoa, what does that say about the opposition's credibility in leading on healthcare reform? We need to be serious. Well, I will, because I mentioned you, but I know I'm running out of time.
How can the member dare to deride me for standing up for the people I represent and who deserve equality in the healthcare system? How can you possibly dare say that you stand here today and deride me for standing up for the people I represent and the patients who are struggling and dealing with their inability to access healthcare systems, healthcare the way everybody else can across the north? I think that's very
The member's
unreasonable.
time's up.
Well, thank you.
A call on Gary Middleton.
Principal Deputy Speaker, and can I congratulate you on your elevation to the position, and also congratulate my colleague Alan Robinson on his excellent maiden speech today. I want to begin my remarks by paying tribute to the fantastic and dedicated health and social care staff right across Northern Ireland. Many of them are working in conditions which actually are very difficult and stressful, and I want to put on record, obviously, our thanks to them first and foremost. As others have mentioned, it is the sad reality that here in Northern Ireland our waiting times are not only the worst across the United Kingdom, but indeed are the worst, or some of the worst, across Western Europe. Over a quarter of Northern Ireland population are on a waiting list. It is also the sad reality that a growing number of our constituents and people within our communities are dying whilst languishing on waiting lists. The findings of the Northern Ireland Audit Office report sends a stark signal of the need to urgently address the missed targets and the ever-growing waiting lists across the board. Of course, I have particular concerns around cancer targets. The latest figures I have is that only the Western Trust met their target for patients being diagnosed with cancer receiving their treatment within 31 days. Of course, as a Foyle MLA, I welcome this particular position and the target being met within the Western Trust, but the reality is that there's many different pictures across other trusts in Northern Ireland. Just 34% of patients urgently referred by a GP with suspected cancer began treatment within 62 days. That's against a 95% target. Western Health and Social Care Trust figure was 44%, whereas the Belfast Trust had the lowest percentage at just 22.6%. And of course, there are big disparities as well across the various specialisms within the sector. Just 52.9% of those patients were seen within 14 days of their urgent referral for breast cancer, against a 100% target. And unfortunately, no trust achieved that target. So this postcode lottery of services is simply not sustainable. Yesterday in this chamber, we spoke in terms of the economy and the need to address regional balance. Of course, we need to ensure that the health system is addressed in terms of regional balance and regional inequalities across the health sector. There are similarly concerning statistics right across all levels of the health and social care system. We heard today of the mental health services, drug and alcohol services. People are waiting extraordinary amount of times to access services which would no doubt go towards improving their life or actually saving their lives as well. I will indeed give way to my colleagues. Sorry.
And I thank the member for giving way. While people are on waiting lists, and I'm glad he mentioned about drug and alcohol services, while people are on waiting lists, they obviously have a deterioration in their mental health, and some of them do turn to drug and alcohol abuse, and therefore that will be more of a cost to our health service while they're on a waiting list. We're actually seeing a problem in other services as a result of that.
The member has an extra minute.
And can I thank the member for that intervention? It's a very timely point because the member touched on the community involuntary sector earlier as well, and the various organisations who can help alleviate the pressure and ensure that there's not a greater cost going down the line. The problem that I and the concern that many of us would have is that the cost ultimately could be a life, and I think that that's something which would concern us all. But I also want to raise the need to address urgent and emergency care as well in terms of our emergency departments. There's frustration at the amount of people, unfortunately, who can't get access to their GPs. The statistics that I have, it said that almost 20% of attendances had been referred to our emergency departments by GPs. That only accounts for those who actually were referred. There's many people, unfortunately, who actually can't get through to a GP, so they themselves just present themselves to the emergency department, even though that mightn't be the most appropriate place for them to be. Does a member? Yeah.
No, as time is running out, so I'll just make a quick point in relation to access to GPs. As others have said, when people are waiting on a waiting list for long periods of time, they start to develop other conditions which will require them to present to their GP or to the emergency department more often. And with that said, do you think then do you agree that we should be using all those tools that are readily available to us to reduce waiting lists in the here and now, including the reinstatement of the Cross-Border Health Directive, which we know has been very successful and works well for our constituents right across the north?
Yeah, no, absolutely, and I think that we need to look at every type of initiative. We see even within our GP services the use of multidisciplinary teams. There's various mechanisms we need to use. We can't rule things out. We need to be looking at what's the best possible outcomes for our constituents. Just in closing, the Audit Office report obviously sets out a number of recommendations. I think at this point, and I agree with members, we have had a lot of strategies. We do need an action plan. We do need something we could point to and say this is now the course of action we're going to take. We've waited far too long for our waiting lists to be addressed. I think now is the time to bring forward that action plan and ensure we can deliver for our constituents. Thank you, Principal Deputy Speaker.
Thank you. Can I call upon Paula Bradshaw, please?
Thank you, Madam Principal Deputy Speaker. I rise to support the motion and the amendment. I will be focusing on what we've learned from the audit report and also from other reports and evidence on how we could do things differently. So the Audit Office report does refer to the need for extra money, and we need to be clear about one thing. The Department of Health already spends approximately £4,000 for every person in Northern Ireland, and I appreciate that we have an ageing population and that multimorbidities and more expensive treatments, for example, but we do have to recognise that we cannot continue to have a greater percentage of the overall budget share, and we need to be using our money more efficiently. So I want to ask the Minister if he could outline, if not today, sometime in the future, how he's going to ensure greater financial accountability in terms of commissioned services within our trust. Those who were on the former Health Committee and others who are watching this will know that if the trust is given a certain amount of money for a certain number of orthopaedic surgery, for example, for 30 and they only deliver 20, they don't have to give the money back for the 10 that they didn't deliver. Now, I have no doubt that the trust has used the money efficiently and for good ends, but there's no accountability and transparency in terms of the use of that money. And that leads me on to the second point, and that's really about the use of locums. I met with the former Chief Executive of the Belfast Health and Social Care Trust in 2016, I think, and he at that time said that we need legislation here in Northern Ireland to put a cap on the amount of money that's spent on locums. That was 8 years ago, and I very much take Colin McGrath's point there around the stop-start nature of our politics here, but we need to be looking at the amount we're spending on our locums. The third point I would make under this is the effective use of our consultants' time. So as people will be aware, consultants are given a certain number of slots a week that they have to deliver. If they use one of those slots travelling down to Skillen, spend some time doing it and travelling back, then they've lost 2 slots in the week. So I think we need to be looking at better use of our consultants' time. Moving on, Principal Deputy Speaker, we have heard a lot of quotation here today around how many people are on the waiting list, but we're talking about cases rather than people. Some people may be on 3 or 4 waiting lists. So I would appreciate if the Minister could tell us how he is going to use that information, bring it forward, so that we have a far clearer picture, because it is ludicrous that we would have so much of a percentage of our population on waiting lists. We need better clarity of how that information is collected and presented. Moving on then as well, my party will be supporting the amendment for the Cross-Border Healthcare Directive, but people need to be clear. What that means is that we are using public money from Northern Ireland to pay private hospitals in the south. And I have many constituents who are delighted about that scheme and want it brought back, and I want to see it brought back. But as I'm going to allow an intervention from the proposer of the amendment, whether you would also be in favour if we extended that scheme so that anybody on the waiting list can use any private provider across these islands, north or south. Is that what the amendment's about?
It's about making sure that we drive those lists down by using any opportunity that there is and use any weapon that's at our disposal. People can't be on waiting lists any longer than they currently have been.
The member has an extra minute.
Thank you, Principal Deputy Speaker. So if the Minister can refer to that. I've never got a straight answer from the Department of Health, Deputy Speaker, as to why, if we're OK sending money south, and I have no problem if it gets people in my constituency off the waiting list, why we would not afford the same opportunity to private providers in the north to drive our waiting list down. So I would like an answer on that. The last area I want to focus, two last areas, and my colleague Nuala McAllister briefly referenced it. And these are very crude figures. It costs £700 per month for domiciliary care. It costs £700 per week for a nursing home, a care home, and it costs £700 per night for a hospital bed. So I would like the Minister at some stage, probably not today, to bring forward his plans for how we're going to bolster our social care sector here in Northern Ireland. I have no doubt that that needs a lot more investment, but I would like to see those plans. We had part of the people in 2016, and whilst there's been great work by the departmental officials, etc., we need firm action, and I would pick up Alan Chambers' point around that. Let's stop talking about it, let's get on with it. And the last thing I would like to say is that we as a party want to see transformation. We want to see Bengoa delivered. We very much have always supported the elective care framework, but we want to see the long-awaited hospital reconfiguration design plan. We need that consulted upon. We need to bring forward the plans, and that, again, action, not words. Thank you.
Thank you, Pauline, and I call Sinead McLaughlin.
Thank you, Principal Deputy Speaker. Imagine that everyone in this chamber knows someone who's waiting on a health procedure, whether it's a family member, whether it's a friend, or whether it's a colleague. We have all seen people wait an interminable amount of time for operations that they should be able to expect in a matter of months. I've lost count of the number of constituents that I have met who are wrecked with stress, anxiety, waiting years in an appointment that could be life-changing, but feels like it may never arrive. Last week we debated the priority given to women's health, and one such area of waiting lists is the gynae services. Responding to a survey that I delivered last year on women's experiencing accessing care told me that her long wait, she said, "It has taken me almost 4 years to get some form of outcome, even though I still believe that they have misdiagnosed me. I am worse now than when they tested me, but I am told a long waiting list is ahead again." This is really a moral outrage in 2024. It's a fundamental failure in government. And I welcome the urgency of this motion, but with the greatest respect, never mind the 6 weeks from now, we should have been here to deliver 2 years ago. The consequence of this latest collapse, and indeed the one before, had been that we have let more people wait in agony in a two-tier system, that where only those who can afford to be seen actually get through the door. These are the human consequences of constant collapse. It is yet another reason, in case we need any more, why we should really commit to never collapsing this place ever again. The transformation of our health service will take time, now much longer than it could have otherwise have taken, but in the meantime we need to follow what works, and that includes restoring the Cross-Border Healthcare Directive. We are one island, and we all know that health problems don't stop at borders. Brexit was a serious blow for our health service, not only because it removed the Cross-Border Healthcare Directive, but it also, under the freedom of movement, we had the ultimate cross-border healthcare directive for our medical professionals, and that is really something that we are all feeling and we all regret, and has added to the waiting times. Now, the very least that we can have is an arrangement again with our closest neighbours. This is sensible and it's practical step that could make a real difference to people right across our communities, and I know that it has served many of my constituents really well.
Will the member give way?
It certainly will.
I thank the member for giving way. Would the member agree with me that the announcement made by the UK Government yesterday about care workers and others not being able to bring their family members with them is utterly punitive, flies in the face of any sort of realisation of the struggle of our health and social care right across the UK, but also in the North? And would she agree with me that that needs to be rescinded at the earliest opportunity?
Sinead, you have an extra minute.
Thank you. I absolutely agree with the member. It's self-sabotage. It's unbelievable that any minister would take that tone and direction when the health service is in complete, disarray right through Tory government. That's all I can say. In the Western Trust alone, more than 700 patients benefit from the Republic of Ireland reimbursement scheme. Restoring it is just common sense, and I hope members from across the chamber will support it. Of course, this is just one measure that will take while we grapple with the longer-term transformation of our health service, that we can bring down waiting lists once and for all. It will not solve this crisis overnight, which is the product of decades of underfunding, political collapse, dysfunction and poor accountability, but it will make a difference for some patients. Mr. Speaker, Principal Deputy Speaker, the motion rightly calls attention to regional disparities in access to our health service. It is true to say that there are huge imbalances in our health outcomes. Although this is a crisis that affects almost everyone, it doesn't affect everyone equally. In recent years, the figures actually show that the male life expectancy has declined in the most deprived areas of Belfast and Derry. While in the Western Trust, male life expectancy is almost 7 years lower than the Trust average, and 24 of our health outcomes are worse than the Northern Ireland average. In my city and region, we have a crisis of addiction and poor mental health, driven by poverty and the failure of government to address that poverty. Yet it appears our health service provision has been regionally blind, failing to step in to address the disadvantage with a weighted deprivation formula that is not apparent at all and that actually fuels the poor health outcomes. We actually need a different approach, one that prioritises disadvantage and directs investment where it is most required. So, Deputy Principal Speaker, I hope that this motion is... Sorry? I want to get this finished off, sorry. I hope that this motion is supported across the House, but more importantly, that it actually leads to change for patients who are desperately in need. And finally, can I thank our healthcare workers right across this province who are doing amazing work under very difficult circumstances, and a call out to our community and voluntary sector who have stepped in and have lost funding over the years and also deserve our grateful thanks.
Members, time's up. Thank you. And before I call the next speaker, which is Saoirse Eastwood, can I just say that Saoirse Eastwood, Justin McNulty and Jerry Carroll are being included on the speakers list known as the grace period. So if you take an intervention, you won't get an extra minute. So if that's understood, I'll call Saoirse.
Thank you, Principal Deputy Speaker. I just wanted to take the opportunity to speak on behalf of my constituents who are impacted by cancer. This is something that impacts everybody across Northern Ireland, and at the minute we are dealing on a constant basis with emails from people who are on red flag referral waiting lists, particularly for breast cancer, and these people are living in utter anxiety. Many families know what it's like to get that call or to get that letter or email or whatever the communication is to say, we think you may have cancer. And let me tell you, them hours are the longest hours and minutes you will ever deal with in your life. And we have condemned people right across the north to waiting unnecessarily, meeting our own targets, smashing through the targets that we have set for them. We need to get really serious about the fact that this is causing people hurt and harm. I feel it would be remiss if I didn't speak on behalf of those people today. The other thing that I think is absolutely crucial in addressing this crisis in terms of all waiting lists, not just elective, but every single function that we have out there, is that of workforce. And I sit in the Economy Committee, and this is something I have raised at every single turn in the road, to say health can't do this alone. It needs support from right across the board. And whenever it comes to economy, the wee bit of a difference that I can make is saying, what are we doing to make sure that we have enough training places in our universities? What are we doing to make sure that health and social care workers are valued, that they have career progression, that they have career pathways, that we as a society value that work and consider it important? Because let's be honest, in the past, far too many people have been content to sit back and regard that work as low or no skilled, unimportant, and worthy of very little pay. These are the people that pick our families up off the floor whenever they are at their most vulnerable. These are the people that go into our families' homes at 2 and 3 in the morning to help with pick lines or to help with drivers. And these are the people that we are not respecting and giving those pathways and that prestige to. As I've said, this is something we're not going to counter through one ministry alone. But what I do know is that Alliance will not be found wanting whenever it comes to supporting and working with the Minister, and we do so with an open hand and an open heart. Finally, I would just like to close by saying that transformation is something we talk about, and it's not easy, I get it. But whenever you have a loved one sitting in hospital facilities for 3 and 4 months, living for 16 weeks at a time, in accommodation that would not be fitting of anywhere else, you understand this is why we need to do transformation. This is why we need to do this. So my family member doesn't have to go through what your family member went through. It's easy to say we want everything, but the only way we're going to do that is by being realistic and honest and doing things in a structured and strategic way that means everyone can get what they want. But we need to do it together, not just one department in isolation. And I know that the Minister will have my support and that of my colleagues. And I thank the Principal Deputy Speaker for giving me the time and the grace period to make my points. Thank you.
Thank you, Saoirse. Call on Justin McNulty.
I rise to support the motion and amendment. This is an extremely important debate, and I want to thank Ms Dodds and Mr Robinson for bringing the motion before us today. I also want to thank my party colleagues, Colin McGrath, Shane McLaughlin and Pat Malone for their very important amendment. Let's make no mistake about it. Waiting lists and waiting times for health and social care services in the North aren't just a crisis, they are a scandal. Throughout the course of this debate today, let us endeavour to reject any assertion that this crisis has been brought about as a consequence of the pandemic. As the motion quite rightly points out, we haven't met a formal waiting time target in the North since 2014. That's 6 years prior to the onset of the pandemic. The statistics are startling, scary and sad. People and family are languishing, trying to manage their pain and languishing, trying to manage their despair. However, I want to guard against the urge to complain about the problem. Instead, I want to focus on identifying solutions. One of the most obvious and inescapable solutions with respect to reviving our health service and addressing the crisis in waiting list centres around pay and conditions for health service staff. Whether it's burnout, sickness rates, attrition levels, forced migration, patient staff safety, or the inability to attract necessary personnel, health service workers are being failed. I've seen this clearly in my own constituency, where there was an exodus of medical specialists from Daisy Hill Hospital when the Southern Trust stonewalled them after raising legitimate concerns about management decisions and genuine grievances about the terms and conditions of their working arrangements. The most critical part of this debate centres around our NH staff. Without them, nothing works. If they aren't being looked after, patients and their clinical outcomes will be impacted. With that in mind, I believe that this Assembly, and indeed the Executive, should be tackling the basic and most fundamental issues first. We know the staff are at breaking point. That's why junior doctors have voted for strike action. That's why there are more nurses leaving the system every year than entering it. That's why bright brains and hard workers are taking their qualifications and practising in the UK, the Republic, Australia, Canada and elsewhere. I wholeheartedly welcome the commitment by the Executive to fund the public sector pay award, but we need to do better than playing catch-up with pay packets. We need decisive action and ambition from this Executive to make the North the most rewarding place on these islands in which to be a healthcare worker. I fully appreciate that this would be a long-term and considerable undertaking for the Executive, but there's no escaping the fact that we need radical action to address the crisis in our health service. If we need radical action in the long term, then we need sensible action in the short term. It's my belief that the most effective step that the Executive could take immediately would be to reinstate the Cross-Border Healthcare Directive as stated in my party, the SDLP's amendment. This would allow people languishing on Northern Ireland waiting lists to access treatment in the Republic as a matter of urgency. This would help to remove the pain and to restore the dignity and quality of life of patients far more quickly than if we try to muddle through on already tried or rehashed solutions. Last John Corlett, waiting lists in the North are not just a crisis, they are a scandal. Everyone is watching this place with hope and goodwill. The people we represent will expect an awful lot more than the same old storm of solutions branded differently and trotted out for show. We have heard and undoubtedly will hear more in relation to the transformation and fundamental reform of the health service. I would respectfully contend that fundamental reform should begin at the fundamental level, with pay and conditions and care and compassion shown for our health service staff. If we get the basics right, then we have a foundation to build on. But if we continue to pay our health service staff poverty wages and expect them to get excited whenever we sign off on a pay rise 2 years late, then none of us can be surprised when doctors, nurses, allied health professionals and medical specialists vote with their feet and take themselves and their talents to a jurisdiction that would pay them what they are worth. And who could blame them? I will finish by saying, Gora Mila Mila Mayogat to our healthcare and social care workers. Gora Mayogat,
Walter, I call Jerry Carroll.
Thank you, Deputy Speaker, and thanks for calling me. I think a lot of people, and health workers in particular, will see today's motion as an admission of guilt from those who have gutted our health service. 3 parties from the current Executive, the DUP, Sinn Féin and the UUP, have held the health portfolio over the last decade, and all 3 have overseen the growing waiting lists, unsafe staffing levels and attacks on health workers' pay. And I should emphasise the issue of workers' pay, Deputy Speaker, because we cannot hope to deal with waiting lists unless we pay health workers properly. We need to pay them properly so we can recruit and retain the staff in our health service. We need to pay them properly because they deserve it. They deserve to be able to provide for themselves and their families. And they deserve it because it is their self-sacrifice that has kept our health service afloat in the face of Stormon's negligence. It is not by accident, Deputy Speaker, that there are thousands of vacancies in our health service. Those vacancies exist because successive health ministers have cut health workers' pay in real terms and funnelled money away from our health service and into the private sector. And I want to stress and emphasise that the Minister should move immediately to bring private health facilities into public ownership to help tackle these waiting lists. So while I agree with the sentiment of today's motion, these sentiments ring absolutely hollow when they come from parties like the DUP and their executive colleagues. Health workers, like all public sector workers, are tired of the performative nonsense. They are tired of listening to politicians who bemoan the skyrocketing health waiting lists while implementing the cuts that are fueling the exact same crisis. People languishing in health waiting lists don't just want to hear their concerns, they want action to deal with them. And it's important to say, Deputy Speaker, that we are under no illusions about the Tory government. They have no interest in protecting our health service, and they have stripped it of resources time and time again. And indeed, Tory policy is the greatest threat to public health on these islands. The problem, as far as I can see, Deputy Speaker, is that instead of standing with our communities and challenging that policy, parties here have followed the Tories into the mire time and time again. They accepted the Tory logic that there is no money for our health service and implemented some of the most brutal cuts in accordance with that warped logic. Worse still, Deputy Speaker, the parties here accepted the Tories' supposed solutions, which are no solutions at all. By its refusing to invest in public services and public sector workers, they have handed record sums to private agency firms and private healthcare facilities who are profiting. They're profiting from the mess Stormont has made. They've surrendered domiciliary care to the private sector, which provides 80% of domiciliary care, giving them carte blanche to exploit health workers and bleed the public purse dry at the same time. Deputy Speaker, I'd love to be able to say those are all things in the past. However, between last night and likely later today, the executive parties are going to ram through another austerity budget with no qualms, no scrutiny and no opposition from the so-called official opposition. Make no mistake, the budget likely to be passed today will add to the waiting list that the executive claims it wants to address. I wonder, Deputy Speaker, if the executive parties truly believe their own propaganda or if they're deliberately trying to deceive the public. I'll leave it to health workers and others to decide, but they should know this. The conversation is taking place primarily because 170,000 public sector workers took strike action over a month ago and demanded a pay rise and investment in our public services. Junior doctors are already preparing to strike over the pitiful sum on offer, and I fully support them. And while it is unfortunate that these life-saving workers have been forced to take strike action on the picket line, it is the surest way to deliver on their demands. If this executive is intent on cutting services, adding the waiting lists and impoverishing public sector workers, then they must be met with an organised response, and that includes workers taking strike action. Thank you.
I thank the member. It's now time for the Minister to respond to the debate. And Minister, you'll have 15 minutes to respond. Thank you.
Okay, thank you, Deputy Speaker, Principal Deputy Speaker, and can I welcome you to your post and look forward to working with you. And I welcome the opportunity to speak to the motion to address all of the many important issues that actually have been highlighted today, but also to thank colleagues for the positive collegiate approach that has been taken in regards to this motion and the very important topic that it brings. And I want to put an outset my thanks for the contributions, but also how I look forward to working with the Health Committee as we tackle these issues together, and the opposition, as well as how we work together to do this. But can I say from the outset that I agree fully that it's deplorable that the waiting list targets have not been met since 2014, because the people of Northern Ireland are not receiving the care they deserve on a timely and effective basis. The member of the opposition wouldn't take an intervention when he talked about the 2014 date and all the programmes and all the strategies that have been set in place. And what I did want to point out to him, it's since 2015 that the Department of Health has not had a recurrent budget. So we've been working on single-year budgets for that entire period of time, which has allowed, or not allowed, many of those strategies actually to be fully implemented. So it's not that they're sitting there doing nothing, it's the fact that the recurrent funding hasn't been there to support them. There have been a lot of words written and spoken over the years about the state of our waiting list, and I don't intend to repeat them all here. However, I agree with many of them. It's a matter of deep worry for me and should bring real inner reflection to all that serve in this place, that so many people have been waiting for so long for diagnosis, so long for treatment, and so long for support. Because as members have said, these are real people. These are our constituents, our friends, our families, and indeed our Assembly colleagues. When someone joins a waiting list, their condition doesn't stand still. And that's the point I think was addressed with Ms Erskine's intervention in regards to the additional complications and the additional needs that actually come with being on a waiting list that hasn't been fully resourced or supported. So it's incumbent on me as Health Minister, but collectively upon us all, to ensure that we're doing everything that we can do possibly to address our waiting lists. Fundamental to that is actually having that clear, time-bound, deliverable action plan. And I agree with the Chair of the Committee. It should be fully resourced with a multi-year budget. So it's in that context, members will actually recall that in June 21, I published an elective care framework which detailed a 5-year plan that had that dual focus of reducing waiting lists and at the same time closing the gap between capacity and demand. That framework, costed at $707 million, contained a range of actions. 55 in total aimed at reducing waiting lists and improving capacity across our elective care system. It also set out how we would invest in and transform services to allow us to meet the population's demand in the future. I also made clear that delivering on that plan would require sustained investment to tackle backlogs, but also increase overall capacity within our health and social care system.
And I take the point around the investment. Would the Minister agree with me that had the budget that had been proposed by my colleague, the former Finance Minister Conor Murphy, for £1 billion for a 3-year budget for health, would have gone some way to tackling the situation we find ourselves in today?
And I thank the Chair of the Committee for her intervention, and I do look forward to working with him, because that £1 billion that was promised was also in the manifesto for the proposers of this motion as well. And it's also clear, and I've already made it clear, that £1 billion capacity gap, or £1 billion financial gap, was also what my department is already highlighting for next year to allow us to stand still. So I do look forward genuinely to work with all my executive colleagues in regards to honouring the commitments that they have publicly made. But I also made it clear then that delivering on that plan would require that sustained investment to tackle those backlogs, but also, as I said, increase the capacity within our health and social care system. So I was heartened by the fact that the framework was agreed to all the executive parties, and commitments were made then that the necessary resources as set out in the accompanying funding plan would be made available. So whilst there has been some progress, of which I will touch on in a moment, no one, including the proposers of this important motion, can have missed the damage that the subsequent further political stalemate and interruption has inflicted. On my last day in office in October 22, after 6 months of a non-functioning executive, I said that patients and staff were being badly let down by the politics of this place, and I hope we'll see a renewed focus from the outset in regards to where we move in regards to supporting health. So in the absence of an executive, and critically in the absence of any budgetary certainty, that framework then was since has been starved of both the political leadership and the funding that it required. So regrettably, therefore, as we're halfway through the point of that 5-year time frame, my department last year already announced that its targets were no longer within reach. Because the situation we face at present is terrible. At the end of September 23, as has been said, the most recent validated figures, there are 430,000 patients waiting for a first consultant-led outpatient appointment, 115,000 patients waiting for inpatient or day case treatment, and just under 190,000 patients waiting for diagnostic tests. Principal Deputy Speaker, these are eye-watering figures for a population of our size. In addition to the backlog of patients waiting, new patients, of course, continue to be added, and inevitably that gap between demand and capacity means the waiting list continue to grow. But that said, and I do want to put on record here, there has been some progress. The 4th interim report of our elective care framework, which was published in January of this year, highlights the start of small but tangible improvements to the waiting list position. As of September 23, inpatient or day case treatment waiting lists have seen some promising improvements. So while still at unacceptable levels, there has been an 8.4%, or just under 11,000 people, decrease in numbers waiting since the same month a year earlier. There's been an improvement in the numbers waiting over 13 weeks. 78.6% of patients were waiting more than 13 weeks for admission, compared to 79.8% on the 30th of September 22. And over 52-week waits have also reduced regionally, albeit still remaining far too high. So it's important we acknowledge and build on improvements to ensure any momentum is not just maintained, but increased. But these alone will not address the backlog and need.
For giving way, thank you very much. There's an issue in particular in the Southern Trust area with MRI scans for paediatric patients, and I'm not aware if it is at the same level right across the region, but could the Minister look at this, because this is a serious issue. I've been told 51 weeks is the wait time for a child that needs anaesthetic, and I know a family that have been told 18 months. These are children in their formative years who are going backwards in terms of their capacity, their building of their development, because they aren't getting the MRI scans that they badly need.
The member will appreciate I don't have a direct answer here today, but I will write to her in regards to that. Because, Principal Deputy Speaker, tackling our lengthy waiting list is undoubtedly a long-term issue that requires sustained and recurrent funding. It requires workforce development and that system-wide transformation. Our health and social care system is complex, and waiting lists are just one component, as has been said here today, when we've expanded the debate into domiciliary care, into care homes, into GPs, and that whole circle approach to health has to be addressed. And as such, our waiting list can't be addressed in isolation. Other fundamentals of the system must be considered and addressed simultaneously. That includes issues such as workforce pay, pressures and capacity in secondary and primary and community care, and ensuring that we maximise the capacity we have within the system. I know that when we see these shocking figures and appalling waiting times, there is an understandable desire to see them reduced immediately. That requires a whole system approach and not just piecemeal interventions that can only deliver for small improvements in the short term or in isolated areas. But that doesn't mean that there are not short-term measures that can be effective. But the key is to achieve the appropriate balance between the short-term effective measures and those longer-term sustainable developments that actually bring about that optimum effect. We know we need to transform our health and social care system to become more effective and efficient, and we know what's required, because that includes the reform and innovation in such areas as our treatment capacity, outpatient reform, imaging, pathology, workforce, and protection of elective care from unscheduled care demands. That work is already well underway, and elective capacity has been enhanced through the continued development of our elective care centres. Key examples that I want to highlight to members are already in place. 2 dedicated day procedure centres at Lagan Valley and Omagh hospitals. 3 elective overnight stay centres at Daisy Hill, the Mater and South West acute hospitals. The expansion of 22 post-anaesthetic care unit beds for elective care across all trusts. 3 specialty centres for cataracts at the Down, South Tyrone and Mid-Ulster. An orthopaedic hub at Musgrave Park Hospital, which includes the Duke of Connaught unit, which is a dedicated orthopaedic day procedure centre. 2 rapid diagnostic centres at White Abbey and South Tyrone hospitals. A regional extracorporeal shock wave lithotripsy centre in the Craigavon Area Hospital. Service reviews in general surgery, orthopaedics, urology and gynaecology, which will set the direction of travel for improvement. The introduction and the maintenance of our mega clinics to maximise patient throughput. Outpatient assessments delivered by GP Federation in primary care settings, and the development of in-house health and social care capacity and the continued investment in staffing. The members in tabling this motion asked that I acknowledge the need to turbocharge investment towards tackling the waiting list backlog. I not only acknowledge that, I stress that investment is actually fundamental to the whole backlog problem that we're facing. And the initiatives for which confirmation of sustainable funding would actually allow further development would include the enhancement of that sustainable workforce capacity through expanding skill mix and the development of specialist nurse roles and those allied health professionals across a range of specialities. The expansion of our pre-op assessment service to improve theatre productivity. Building our own diagnostic capacity to reduce the reliance on the independent sector capacity. Building capacity and throughput across regional elective care services such as urology, paediatrics and orthopaedics. Today's motion asks that I publish an updated action plan to tackle the waiting time crisis within 6 weeks. The action plan to tackle waiting lists within the health and social care system already exists. I don't want to waste time replicating what is already clearly set out in the elective care framework, because I believe enough time has been already lost. It is, however, almost 3 years since the plan was published, and as with all plans, it's important that it is reviewed to ensure that it takes account of relevant changes within our overall health and social care environment and is updated to reflect them. And it's for that reason that I have tasked officials to review the framework, and that review is ongoing and will be completed by June this year. Motion also tabled stresses the value of partnering on a much larger scale with national and independent providers to maximise existing capacity. I believe that's essential, and we take all measures and use all resources within our means to ensure effective delivery of services, and that includes the use of our independent sector. This is what we have been doing with the limited additional resources that have been deployed for waiting list initiatives. We need greater investment in this area, and we want to achieve the results and impact on waiting lists the people of Northern Ireland need and the people of Northern Ireland actually deserve. However, maximum efficiency in the use of the independent sector can also only be achieved in multi-year contracts, or at least 3 years when they're agreed. This will also provide better value for money. As members will be aware, I introduced the Republic of Ireland reimbursement scheme on the 30th of June 2021 as part of the elective care framework. In June 2022, I announced that the scheme would be extended beyond the planned deadline until an additional $5 million of new funding had been committed. The scheme closed to new applicants on Wednesday the 21st of September 2022 when that additional $5 million funding had been exhausted. I can assure members that I will be leaving no stone unturned as part of my broader consideration to resource investment in reducing waiting lists. I will invest what limited funding there is wherever it will have the greatest possible impact. However, the task ahead will be much easier if all parties will do all they can to support the adequate and multi-year funding settlements. In the meantime, work is also currently underway to provide further building blocks to tackle waiting lists. This includes plans for service reviews of paediatric orthopaedics, and I thank the Principal Deputy Speaker for her support in bringing this motion. I thank the members who brought it and the support of the entire House.
Thank you, Minister. Cara Hunter is winding on the amendment, and Cara, you have 5 minutes to wind.
Thank you, Principal Deputy Speaker, and I'd like to thank the Minister for his contribution here today, and hopefully I can get through this in 5 minutes. But I'd like to thank each and every member who has spoken here today, and I'll touch on some of their contributions and reflections. I'd like to thank Liz Kimmins. She touched on the importance of urgency in making tough decisions. Mr Donnelly touched on the dramatic increase of 216%, highlighting how our lists worsen without intervention and the issues that is causing. Mr Chambers touched on the importance of the point that the pain our patients endure while waiting to be seen, and Jerry Carroll, of course, touched on the importance of paying our workers, something I wholeheartedly share with him. We spoke weeks previous as well about the vital need for a women's health strategy, and I acknowledge Ms Diane Dodd's contribution around gynecological waiting lists. I've spoken with many women in my constituency office, many of whom have awful cramps, heavy bleeding, bent over in pain, and yet cannot be seen by a specialist, and that they can't work. It's just completely ruined their lives, and it can be indicative, as we've talked about before, as endometriosis or worse, potentially cervical cancer, and they're left with the mental agony of that, the unknown and the uncertainty. And as we stand here today, thousands of our people, our constituents, are waiting on these lists, and oftentimes are untreated and unmedicated. And Sinead McLaughlin touched on the importance of the postcode lottery aspect, as did Mr Robinson, and the issue of regional imbalance. Orlia and Deborah touched on the importance of children's mental health issue I know both of you care deeply about, and I too have talked previously about the delays within the Northern Trust for the access to CAMHS and the impact that that's having on children and families. So waiting lists impact the whole family as well. I'm also thinking today of a mother in my constituency who has a child with special educational needs who had an abscess in their mouth and was left for months without being able to be seen to receive oral health care, and no one in the house was sleeping. The child was in agony. So it's that real family impact of these waiting lists. I also recall a lovely young woman who I met in my constituency office who had cancer, who had surgery for cancer, and there was an issue with her bowel. She came out of surgery and was told that they would go back in and rectify the issue, and it would be a matter of weeks, but it was actually a matter of months, and she was just in agony, and again she couldn't sleep as well. So I just think it's really important that we touch on those personal stories here wherever given the opportunity. And you know, Miss Eastwood touched on just these challenges facing cancer patients, and she done so very eloquently. But how have we got here? But more importantly, what can we do to get out of this? And I think that's why we come to our amendment here today. And the Minister rightfully touched on maximising every opportunity given to us. And we know we've seen cross-border initiatives have been extremely positive, and reigniting those cross-border schemes is a real step in the right direction, a positive direction, especially I know my own constituency constituency for those awaiting hip and knee surgeries. I think there's also the aspect that we really want to ensure that patients who are on health waiting lists are being told there is communication as to where they are on the list, how long potentially. That's been an issue that's been raised to me as an MLA, and that will help them, I think, have an understanding of where they are and when they'll be seen, because it does impact mental health. And I'd like to congratulate my East Derry colleague, Mr Robinson, on his maiden speech. And I think he really did touch on the aspect of this is a two-tiered approach for those who can pay due and for those who can't suffer. In 2015, I actually went to America for surgery. I had had sepsis twice in a very short period of time, and was told by a specialist in Alton Galvin Hospital that if I had sepsis a third time, it wouldn't be good, but was also told in the same breath that I could be waiting 3-4 years for surgery. So thankfully I have a very good mummy who paid out so I could go see family in America and have surgery, and thankfully my health has been relatively good ever since. But that's just my own personal story, and the uncertainty that is present there when you don't know when you will get the health care that you so desperately need. And I think we can't have this debate without the discussion around this place is up and down. Sometimes I refer to the Assembly, it's up and down so often it's like a bouncy castle, and we can't deny that that's having a direct impact on our constituents who are sitting as we're here today in agony on waiting lists. So Minister, any opportunity that you have to utilise cross-border schemes in this House, certainly we will work as constructive opposition alongside yourself to ensure that we deliver for our constituents and essentially alleviate their pain in any way that we can. And I thank those who are supporting our amendment here today. Thank you.
Thank you, Cara. I call on Deborah Erskine to wind on the motion, and Deborah, you have 10 minutes.
Thank you, Principal Deputy Speaker, and I welcome this debate today, which calls on action for our waiting lists. Day and daily, as it's been said in this chamber, we're contacted by constituents who are sitting on waiting lists in Northern Ireland, and for many actually they simply don't know how long they will be on waiting lists, and that is an unsustainable situation, and we have to be realistic to the challenges. And it's been pointed out here today that whilst money is important and we need that extra investment, as my friend for Upper Bam pointed out, Deanne Dodds, we must also work to increase in training of our students, recruitment and retention of surgeons, doctors and nurses to ensure that there is a sustainable workforce going forward. And we are competing with higher pay in the likes of the Republic of Ireland, which I know the colleague there, Danny Donnelly, pointed out during his contributions, and that can affect health trusts like my own in the Western Trust, which are closer to the border, and that is an issue that we do have to tackle. The holistic approach to care must also be in place, which I pointed out during my interventions, to drive down not just waiting lists but stabilise the system, and we need a root and branch plan going forward. We need to have the maximisation of our existing capacity through, and the Health Minister pointed this out, in terms of designating more sites as dedicated elective centres, 7-day theatre schedules, multidisciplinary mega clinics, and establishing regional diagnostic centres and rapid diagnostic centres, which he pointed out. And there will also be the need to make sure that we organise our services in the most appropriate way as well through our transformation, and actually that's going to take a change of mindset within our public as well. And we must realise that maybe travelling to another site outside of our trust service may be needed, and it's on all of us in this chamber to actually step out of this chamber and make that point to the communities that we represent. And I say that as somebody who comes from a rural area, but I want to make progress, but it's just to say that our public transport on our roads must reflect the transformation that is needed once we talk about this. So there's a cross-departmental element. Principal Deputy Speaker, I want to move to some of the members' comments that were made today as well. And I want to thank Deanne Dodds, who mentioned the very stark waiting time figures and indeed the postcode lottery. And she mentioned ways in which we could bring forward solutions to be found. I have to say, moving to the SDLP and Colin McGrath's contribution, I hope that I have seen a Damascus Road conversion for the SDLP here today. I really do, because he talked about plans and strategies that sit in rooms. See, when they come out of rooms and get dusted down, I hope the SDLP step up and actually stand by those plans and don't go on picket lines to be parish pump about health on issues, and actually act with all of us in the chamber to implement transformation. I want to make progress. Liz Kimmins, in her intervention, thank her obviously in her role as Health Committee Chair. She said exactly, we can't keep doing the same thing and expecting the same outcomes, and I welcome the fact that her as Chair of Health Committee will be using her voice to drive forward some of that change as well. And I mentioned Danny Donnelly's contribution as well, and I thank him for pointing out the differences in pay that is causing issues. Alan Chambers, he mentioned the stress and pain of those who continue to be on waiting list, and that is going to take further intervention from our health service, which was pointed out. And as I said, I thank Orlia Flynn for her mention of mental health services as well. Moving on to my member, Alan Robinson, and I congratulate him on his maiden speech. And please do pass on our good wishes to George Robinson from all of us in this chamber. We do wish him well in his retirement. And I thank Alan and Cara Hunter for sharing their own personal stories of being on waiting lists, which is not an easy place to be. And I thank Nuala McAllister for raising the equity of service and the discharge times, which is also very, very important as well, and the succession planning in terms of where we go forward with consultants and surgeons, because it takes a while to train people in our health service, and we have to be realistic that if we need to start planning for some of that stuff now. And I thank my colleague Gary Middleton, who paid tribute, as I know a number of people did in the chamber, to our dedicated health staff, which are at the heart of all of this. I want to move on. Paula Bradshaw, she raised very important points in terms of investment and timing around consultants' time as well. And I do agree with her in terms of if we're taking funding and putting that into elsewhere to shape our waiting list, surely that can be invested here in Northern Ireland to help, and it's a very fundamental point. I thank Sinead McLaughlin for raising about gynae issues following on from our women's health debate, and also for Sorcha Eastwood for mentioning specifically about cancer. And we send our good wishes to her family and her husband as well at this time. It's a deeply personal thing that she raised in the chamber, and I thank her for that. Justin McNulty, he raised about the burnout of our trust workers, and I think it's important to note that in this debate. But again, regrettably, when we come to Jerry Carroll, we see again the party politics creeping in relation to health. And I just want to say, I agree with him in terms of fair pay for our workers, but let's strip politics out of health. If we're taking anything away from this chamber today, let us work together collectively to deal with the issues. We will all, as I said, have to walk out of this chamber and try and put the message to our communities that we need to change our health service and shape it. And I regret the fact that people use party politicking over things where there are people behind these statistics, as has been stated in this chamber today. I would like to move on. The member has had enough time to make his comments today. Lastly, I thank the Health Minister for coming to the chamber to respond, and I welcome his commitment to tackling this issue. as he pointed out his elective care framework. I'm also pleased to see that he reads the UP manifestos in terms of the 1 billion that we would like to see invested in our healthcare. And I welcome that he will review the waiting list framework, which was published 3 years ago. Whilst it will be, I think he said, concluded in June, from there on in, my plea is that we see action in relation to that action plan, and certainly from my point of view and my party's point of view, and I think that was collective in this chamber today, we want to see action on this. So I thank everybody for their comments today in this debate.
Thank you, Deborah. The question is that the amendment standing in the names of Colin McGrath, Sinead McLaughlin and Patsy McGlone be made. All those in favour say aye. Aye. Contrary if any, no. The ayes have it. The ayes have it. The question is that the motion as amended be agreed. All those in favour say aye. Aye. Contrary if any, no. The ayes have it. The ayes have it. Members, would you take your ease? Do we change the staff at the top table? Please, thank you.